Hey everyone, welcome to another video here from the windowcleaningstore.com. In today's video, we're going to be focusing on a window cleaner injury that is actually really quite common. And when you're thinking about window cleaner injuries, you might be thinking about the obvious, like maybe falling off a ladder or tripping down some stairs while in the course of your workday. Hopefully, if you use your brain, you think ahead, you plan ahead, you be smart about things, you should never have to worry about having a ladder injury or, like I say, tripping down some stairs or something. Work smart and this shouldn't happen. However, there are some types of injuries that are almost impossible to avoid at some point in your career as a window cleaner. And most of the time it happens from people who use tools such as squeegees, scrubbers, squeegees, extension poles and whatnot. And it is a repetitive stress injury or repetitive movement injury. And the most common areas where people feel the result of the injury is somewhere around the elbow. We're talking about usually the top side of the elbow, either just below it or just above the elbow joint. Some feel it down into their wrist or even their fingers. You notice here, moving my fingers, you can see the muscles moving throughout the forearm. So this is how far it goes down, as well as just a little bit above there. And doing things such as squeegeeing hours on end, holding extension poles in a certain way, gripping the tools too hard, you can certainly get a lot of wear and tear in the muscles in the forearm. Everything that's going on in the forearms will affect somewhere above or below it. So when some people get elbow pain, they automatically think there's a problem with the joint. It's actually from the muscles and the tendons where they join onto the elbow muscle right here. So we're going to take a look at a few ways that you can rehabilitate yourself without having to go to the doctor or something. If it's really bad, of course you should get it checked out. But if you start to feel a little bit of elbow pain, if it's on the outside, it's known as tennis elbow. If it's on the inside, it's called golfer's elbow. And more often than not with window cleaners, it's on the outside. So we're going to focus mostly on the outside. So like I said, what you have here is you have either tired, sore muscles, tightness, muscle knots can build up, even some adhesions if you go very long time without trying to remedy the situation, you can actually get scar tissue build up. So the first thing we want to do is, if it just starts to happen, just applying some massage. There's a couple different ways you can do it. I like to take some oil, some natural oil. This is a coconut oil, and I'll put it on the area. I'll give it a squirt there. I'll start to work it in, and then I'll start to, with my thumb, I'll start to press amongst the muscle, feel if I can feel any tightness or feel any knots. If you do feel a knot, what will happen is you'll feel like a little, maybe like a little pea size or a little small little ball underneath the skin in and around the muscle tissue. If you find something like that, you might find that it's a little bit tender. You can just stop when you find that spot, hold, make sure you breathe. Another good thing too is that before you start working any kind of massage, to drink lots of water too, because you want lots of water and a lot of oxygen to be able to go through the blood, bringing healing along with it. So if you feel knots in the muscles, you can certainly hold it for several seconds, maybe try to get those knots to release. Sometimes it gets really bad, and I'm going to show you a technique that I've learned. If you've let this go for a long time and you really, it's more of a chronic thing going on here, what you can do, again, you can apply a little bit of oil to the area, work it in a little bit, and then grab something as common as a butter knife. You want it to have a smooth, round edge. You're not going to be using the knife part, you're going to be using the handle part. And what you can actually do is, just on an angle, you can go down through the muscle fibers. And if you do have something going on there with knots or scar tissue building up, what you're probably going to notice is some areas is nice and smooth. That's the area where there's not a problem. But then you might find an area where it's actually like very rough texture, almost like you're going over thick gravel as opposed to smooth sand. And you can do that over and over again. And what you'll notice too is that if there is an area that you've got a problem, you'll start to notice a bit of redness form. And that's absolutely normal. That's the blood coming down into the muscles to bring healing. So you want to do this probably for about a minute or two, and then you can also do it in the opposite direction. Now, what I noticed for myself is going down, I didn't feel too much grit, but coming back up, I'm like feeling like, it's definitely something going on there in my forearm muscles. For me, what I do, what I've sense as a sensation or a negative sensation is I have a tendency to get sore wrists and sore fingers, sore hands. So even though it's a little bit of ache here that I can tolerate, it's the problem of just doing things with my hands, working on the keyboard at work or whatever. I'm also a musician, so sometimes working with my fingers, my hands are kind of sore, and that's actually caused from this here. And like I say, it's a repetitive stress injury, so it's like from doing this all day long, for day after day. If you've been in the game for a while, year after year, if you're getting older, of course, your tendons are probably just as old as you are, even though we do form new muscle tissues over the years. The tendons, that's original equipment. So it's not unusual for this to be a problem. Now, one of the other things I want to show you, because I did talk about scar tissue buildup, one of the things you want to do is stretch and strengthen. Before I do that, I just want to show you, if you don't want to use a butter knife, you can use something like a tension ball or a spiky ball. I do that sometimes too. I like the spiky ball, so what I'll do is I'll just roll it in on the muscle. Helps to kind of tenderize it, break up the muscle tissue. If you don't have something like this, the butter knife usually does a pretty good job. But one of the other things you want to do is strengthen and stretch out those tendons. And so there's a technique where you can use a weight, you can use a weight plate or a small dumbbell or even like a can of pop or water, where you have on the surface, you have your arm going across the surface and you bring the weight up with your other hand, and then you just slowly let your hand go down. And what that's going to do is that's going to stretch out those muscle fibers. So you bring it up again, you assist it up, and you slowly let it down. Every time you're doing that, you give that a nice stretch. And what that's going to do is that's going to break up any lesions or knots in the muscles and create a nice even healing effect. So, if you got knots like this, what's going to happen is you'll end up getting a nice smooth layers of muscle tissue the way they're supposed to be. So you might want to do like repetitions of, maybe 10 repetitions, take a little bit of a break, do another 10, give yourself another break. You might want to do like this 3 or 4 times in one session, both arms, and then you might want to do it maybe twice a day. Another thing, like we talked about the golfer's elbow, you can also do the same thing with the golfer's elbow. So with your hand over there, you bring that up, and then you stretch that out. Assist it up, stretch it out. Okay, just like that there. There's one other tool I'd like to show you. So this is a flex bar. This particular one is called a Theraband. That's the brand name. I'm going to show you how to do the same thing as what we were doing with the weight plate. Like I said, you could do that weight plate, small dumbbell, or can of pop or juice or water or whatever to help stretch out the muscle. This particular thing will help to stretch out and also to strengthen quite a bit. And the way this works here is you want to create a pre-tension. So if we want to stretch out the muscles in the forearm, what we're going to do is with the left hand, we'll bring this around here. And with the right hand, we'll bring that there. We'll twist it. We get it in a pre-twisted position. And then to bring it back, this bar back to the normal shape, we'll have to slowly release that. And every time we slowly release it, the forearm muscles get a nice stretch. And because we're doing it slow, we're also building up strength at the same time. So preload it, release. Preload it, release. reload it, release. And again, you're going to want to do both sides. Even if you feel it more on one side or the other, never hurts to do both sides. That way you can stop anything from starting up on the other side as well. So to do that, bring the right hand around, bring the left hand around, pre-twist it, release. Pre-twist it, release. Pre-twist it, release. So you want to do about 3 sets of 10 of this a couple times a day. Now, that's about it as far as basic therapy. If you have anything above and beyond that, of course, you should seek medical treatment. I like to try to avoid taking things such as Tylenol or ibuprofen or whatever. I would much rather try to rehabilitate myself as much as possible through these types of methods. Of course, if it's really bad, you might have to take something. And if it's really bad, of course, and this kind of thing doesn't work for you, definitely seek out some medical treatment. But one last thing I want to leave you with is just remember, if you're feeling pain in your elbows and your forearms, your wrist, fingers, whatnot, from doing your work as a window cleaner, it didn't happen overnight. This is not an overnight injury. It wasn't like, Monday through Thursday, you're 100%, and then Friday, all of a sudden, you're like, oh my goodness, I have so much elbow pain. Usually you're going to notice that it gradually gets, first you notice something weird's going on, then over maybe several more weeks, it's becoming more and more apparent. And because of it's a gradual thing that builds up, it's also going to be a gradual thing to fix. You're not going to have your elbows all fixed up within 1 week of doing this. This is something you might take several weeks or even several months to get it back to 100% normal. So be patient with it, and you'll probably get to a certain point when you just suddenly realize out of the blue, hey, my forearms no longer give me a lot of aggravation, and that's a good thing. Get back to work making good money as a window cleaner. Anyway, hopefully you found this this video helpful, not too boring. I talked a lot today. Anyway, thanks for watching the windowcleaningstore.com. We've got videos to help you with your business, tool selection, as well as keeping you healthy and out there, making your business and killing it. All right, thanks for watching. Bye for now.